And good evening, everyone. My name is Dr. Gary Rads. I am coming to you tonight from Denver, Colorado. Thank you for joining, and hopefully I can give you some useful information that will help make a difference in what you're doing in your practice. So, as we begin, if you are taking notes, you might want to jot down my email address, which is radzDDS@aol.com. I will be taking questions at the end of the program. I'll get through as many as I can. But if there's questions you still have later, you are welcome to use that address to communicate with me. And I will do my best to help you and get back to you as quick as I can. So, all right, onward. Okay, the obligatory picture of the family. Just a little bit about me. I practice in Denver, Colorado, and I've been in private practice for 28 years. That arrow is pointing to the building where I work behind that tree. But I practice in downtown Denver in a 40-story office building. And I've been in this building for 20 years. But the rest of the bio stuff may or may not be of any interest, but I have been on faculty at the University of Colorado School of Dentistry since 2004. I work with a number of different dental journals on the editorial board, have been very active in the AACD over the years and helped put on many of the meetings over time. I've completed GPR and AGD residency programs. I've published in a lot of different journals, which, if nothing else, just shows I've been doing this for a really long time. I am one of the founding members of Catapult Education, which is a great group of educators and a great place, aside from Viva Learning, for online education is to go to Catapult Education. And there's a lot of great online learning available there as well. So in Denver this time of year, if you're to drive an hour or two up in the mountains and get above 10,000 feet, it's going to start looking like this real soon. Obviously don't know where everybody is that's listening tonight, but where I live, it's starting to get chilly at night, and we're going to get snow and color change up in the mountains really, really soon. Beautiful time of the year around here. Okay, so into the subject matter for tonight. What I want to share with you is a lot of different things I've learned over almost 30 years of practice, a lot of things that haven't changed much over that time, but things I've learned and things that have worked for me clinically for a really long time to be very successful in making great impressions so that I can get back great restorations. And when I was working on this and trying to distill it down is what information can you share in less than an hour that can help make a difference. And I think it really comes down to three things. It's technique, it's tray selection, and it's the material used and the proper use of that material. So what I want to do is just step by step go through each of these. And the things I would tell you to look for is what are some things I'm talking about that maybe you're doing differently. And if there's one or two things in here that I'm doing that you're not doing, I would ask that you just give it a try, the things that I'm doing differently, and see if that doesn't help you be more successful with what you're doing when you're taking impressions. Probably the most critical part about taking impressions is the soft tissue control. Taking impressions, no matter how hydrophilic or flowable or viscous a material is, if you cannot visibly see the margin of that crown, veneer, bridge, implant, if you can't see that visually, you're not going to be able to capture it with an impression material. So it is absolutely critical that when you're getting ready to take an impression, that you take the time and effort, and however much time and effort that is, to get proper control of the soft tissue so that you can see your margins, because if you can see them, you have a much better chance of capturing them in the material. So what I want to share next is the many different things that I'll use either individually or in combination to be able to control the soft tissue, manage the fluid in the area of where I want to capture the impression so that we can get all the detail that we're looking for when we get the final impression completed. So this slide that I'll share with you is one of the things that I think Ultradent does really well is they put together a selection of materials that can do a great job in helping with manage your soft tissue. So from the retraction cords to the hemostatic solutions that they have, these things, when used and used properly, will absolutely help you isolate the area that you need to isolate and that you need to control the fluid and the hemorrhage so that you can capture a good impression. So this is some of the product line that we have, and we'll talk about these in a second. So retraction cord, be it Ultradent's or any other manufacturers, retraction cord still, after all these years, is a necessary part of having in your armamentarium, in your operatory, to be able to manage soft tissue. Using cord to physically displace tissue and to help with hemorrhage control is critical and will absolutely make a difference when you go to take your impression. Oftentimes, retraction cord will be used in combination with some sort of hemostatic solution. Again, this is Ultradent's, but there are certainly others out on the market. But you need to have some sort of hemostatic solution available as well. Because even if you're using retraction cord, doesn't mean you are going to stop hemorrhage that's happening at your preparation site. So just a clinical example of a challenging case where in combination, we've used retraction cord and a hemostatic agent to get the area ready for the final impression. So one of the most foolproof techniques, although time intensive, one of the most foolproof and proven techniques that's been used for many, many years is the two-cord retraction technique. So in doing this in the area, and you can see here we have two bicuspids that we're ready to take an impression of, you pack your initial cord and then you bury that cord. Over the top of that, you'll place a second cord. And what this will do is the first cord gets down underneath the margin into the sulcus and starts to displace the tissue. When you place the second cord, it reinforces the retraction displacement of the first cord. Now, the key to this is after you place the second cord, there's good research out there showing you need to let that second cord sit for 5 minutes. And this is hard to do because by the time we get to this point in the preparation, we're tired, the patient's tired, we may have another patient in another operatory. But to get the most beneficial effects in the two-cord technique, you place both cords, leave the second cord in for 5 minutes. Then, when you're ready to take your impression, you pull the top cord, and as you can see here, now that tissue is fully displaced. There's no fluid, no hemorrhage in the area, and you can clearly see not only the margin of the preparation, but also some of the unprepared tooth below. And that's critically important when they go to trim your dies, because if the lab, can see some of the unprepared tooth when they go to trim the die, not only will they be able to see your margins well, they can start to see the emergence profile of the tooth, which will help them with the anatomical contours of the final crown. And then just another picture of that. And as a quick side note, I do want to give credit to Dr. Bob Lowe, who has shared these photos with me. I asked Bob to borrow these because I think he has captured in his photography some of the best views I've ever seen of this technique. And there's such beautiful slides. I asked Bob if I could borrow them for him. So thank you, Dr. Lowe, for sharing. Okay, so that's the two-chord technique. That's very traditional, been in place in a long time, tried, true, proven. It's also probably the slowest of all these techniques to control tissue. But if you have time to do it, the dedication to do it, if you have a skilled dental assistant that can do this for you, it's a great technique that has proven time and time again over the years to be successful. Now, another technique that we've been using a lot the last decade or two is a technique where we use a laser, typically a diode laser, and we use a technique called troughing. And that's where we use the diode laser to trough out the tissue around the margin, using the troughing to expose the margin, but also the diode laser can do a good job of controlling hemorrhage in the area and stopping that bleeding that oftentimes you'll have after you take a crown prep. So this series of pictures just shows the final preparation, and then instead of placing cord, the diode laser is used to create a very minimal trough all the way around the preparation to where you can see in the third slide, the margins are exposed, there's no hemorrhage present, the fluid is under control, the area is dry, the tissue is displaced, and now it is ready for you to be able to take a great impression in that area. Now, lots of times with troughing, when I use this technique, I oftentimes will have to follow up a little bit with a hemostatic agent, such as Viscostat or Viscostat Clear, because I'll still have a little bit of hemorrhage that the laser wasn't quite able to control, or I don't want to use the laser as much in that area. Worried about where the final margin of the tissue will be. So instead of going back with the laser, we'll take the hemostatic agent, apply it to the area as needed, and use that to stop any hemorrhage, and then take the final impression. The latest material that's been introduced to the market, and it's been on the market for at least a decade, are retraction pastes. So these can be used like hemostatic agents, either by themselves or in combination with other techniques. So what's being demonstrated here is we've got some bridge abutments. We're using the laser to better expose the area to displace the tissue. And then we're following that up with a material called Expasil, which is one of several retraction pastes on the market. But what the Expasil will do is you place that around the tissue. Within this putty-like material, there is a hemostatic agent, typically an aluminous-based hemostatic material. And that will help with hemorrhage control, but also these pastes will, when put in compression, will provide a little bit of expansion of the tissue and get some retraction of the tissue to be able to expose the margins better. So if you look at the bottom right slide, you can see where up here on the top left, we had a lot of tissue in the way and weren't able to see the margins very well. We exposed the margins using the diode laser. We use a retraction paste to get better control of the hemorrhage, but also we'll start to displace the tissue so that we're able to see all the margin that we want to capture in the impression. So in this series, before placing cord, I use the diode laser to get rid of a little bit of excess tissue, expose the margins better. And then used a 2-cord technique to be able to get further tissue retraction and better capture all the margins of this multiple unit full arch case. While we're doing this product called Hemoseal Inside, we're using that to clean and disinfect the prepared teeth. Hemoseal Inside is similar to where many of you would use Gluma or some other glutaraldehyde to disinfect and to desensitize. The difference between those products and the Hemoseal Inside is Hemoseal Inside is based with a chlorhexidine product versus a glutaraldehyde product. So for those of you who are concerned about what's glutaraldehyde do and is it a little too strong of a chemical to be using on the teeth and the human body, worried about some of the minor tissue irritation or tissue burns you get with glutaraldehyde, this is another alternative. And the studies on this material show that it will be as effective, if not more effective, in decreasing sensitivity in the temporary phase and the permanent phase than a glutaraldehyde-based material. So if you're using something like that to clean and disinfect your preps with, you may want to look at this product as an alternative because it will not have the glutaraldehyde, and from a cost standpoint is less expensive as well. But just another trick that we do, because whenever we place cord or I leave the room and the dental assistant is preparing the area and getting hemorrhage control, she will always use this product on the preparation itself to clean, disinfect, and hopefully get a desensitizing effect. So we pull the second cord, and now you can see all the margins are exposed, all the tissues controlled, there is no hemorrhage, and we're ready to take the final impression where we are able to capture all of these margins on all 10 teeth. There's no hemorrhage present. All the margins are captured cleanly, and we've got a good final impression. Okay, tray selection. A lot of different types of trays that we can use. What combination should we use when? We know impression material is expensive and full arch impressions are uncomfortable, and a lot of us try to avoid full arch impressions when we can. And quadrant trays absolutely have their place in the dental practice. It's just when to use them, when is the right time to use them, and when do you need to put those aside and go to something different. So in my practice, if I'm doing a single unit that is not the posterior stop, and I'll come back to that in a second, but with single units, a majority of the time, we'll do that in a quadrant tray. Okay. The exception to that is when our prepared tooth is the most posterior in that arch. We will not use a quadrant tray then we go to a full tray. The reason for that is, and it's been demonstrated and it's been shown in the research, that the full arch tray is more stable when mounted than a quadrant tray. And what will happen with the quadrant tray, if it's the most posterior tooth that's being prepped that you want to record, your bite registration can be off just a little bit. And it may be one of those things why when you try in that second molar and you did it in a quadrant tray, you find that your occlusion is off and you have to do a lot of occlusal adjustment to get the crown to fit. Okay, most likely one of the reasons that's happening is the instability of the bite registration when you're trying to capture the most posterior tooth. So I would always try to avoid that. That's the only time with a single unit that I won't use a quadrant tray. With anterior teeth, if I'm doing 4 consecutive teeth or less, if I'm doing lateral to lateral veneers or crowns or bridge, I'll use an anterior quadrant tray because I'm going to capture all the way back to the first premolar. I'm going to have solid, stable posterior stops, so my bite and my mounting will be correct. So on anterior teeth, many times, if it's 4 teeth or less, I'll use the anterior quadrant tray. The other time I'll use quadrant trays is if I'm doing a lower first molar, I'm doing a crown on a lower first molar, and the opposing upper first molar, I'm also doing a crown on. I can do that with quadrant trays and still have an excellent mounting, and my occlusion will be fine. So quadrant trays absolutely have their place, but you have to understand the limits. Because when you're mounting a quadrant tray, you need to have multiple stable occlusal stops for your mounting so that your mounting is correct and that your occlusal anatomy and your occlusal contacts are correct in your final restoration. Along the lines of quadrant trays are closed bite trays, most popularly known as triple trays. Triple tray is a premier product, and everybody uses that name for a closed bite tray because triple trays basically become the Kleenex of facial tissue. It's the name everybody knows. But the generic name of these types of trays are closed bite trays. There is a place for these. This type of tray, I think, is been overused in the industry and misused in the industry. Where I think you can use them is if they're fabricated correctly, first of all. So if you look at this product, and these are therm trays by Advantage Dental Products, these are designed really well. For a closed bite tray, I like these. And the reason I like these is your walls, the lateral walls, are a very hard, firm plastic that cannot distort. Some of these closed bite trays, the lateral walls here are very flimsy, and in compression, when you're taking your impression, those lateral walls can distort in the impression. That distortion gets transferred on to your working model, which will get transferred onto your crown, and you will see, whether talking to friends or in the literature, or certainly when you talk to labs, that one of the frustrations the labs have is they get crowns sent back to them that absolutely fit the model because the model fit the impression, but the impression was distorted because these lateral walls on the trays will distort in compression, leading to a distorted model. Closed bite trays that work well and that I would recommend are designed like this. They have long lateral walls, and the lateral walls are very firm to prevent distortion. So closed bite trays, the ones that are designed correctly, those can be used with the same limitations that I just provided for quadrant trays. They are excellent for doing single units. They are excellent if you're doing 2 adjacent units, as long as one of the adjacent units is not the most posterior tooth. With these, you still need the posterior tooth to have a good stable stop. But if I'm doing 2 premolars and I've got the molars present, these work great. So the same ideas that I shared with quadrant trays, I would transfer to closed bite trays. And then the only thing unique about these, and the reason I use these therma trays for my closed bite trays, is this film right here that separates the occlusal parts of the teeth when closed. This is a thermoplastic material. So this material you place in a water bath in warm water. This goes from an opaque color to a clear color. The clear color will actually record the opposing occlusion. So when you load your impression material, you only load it on the preparation side. You have the patient bite into it. Your impression of your prep is recorded in the impression material. But on the opposing side, and I think I've got it in the next picture, the opposing side is recorded in the thermoplastic material. And what this does, the advantage of this, is you use less material. According to the company, you use 40% less material because you don't have to load the opposing side with impression material. The opposing occlusion is actually captured in the thermoplastic material, which will go from soft to hard in the 2, 3 minutes, 4 minutes, you've got your impression in place. So when this is set, this will be set here as well. So just a rather unique product on the market, well designed. If I was going to use, when I use a closed bite system, these are the trays I use. Okay, full arch trays. For full arch trays, if I'm doing 3 or more posterior teeth in an arch, absolutely going to use a full arch tray. If the most terminal tooth in that arch is the prepared tooth, I'm going to do a full arch tray. If it's 5 or more anterior units, I'm going to do a full arch tray. If I'm doing bridges, except for a Maryland style bridge, but if I'm doing a bridge, I'm always using a full arch tray. And I personally use stock trays. I keep a number of different varieties and sizes in the office, always trying the full arch tray in to make sure we're not too big, we're not too small, finding that one that's just right for that particular patient. And I appreciate the fact that we are trying to save money and cut costs where we can in our office, but to spend a few dollars more for a little more impression material to be able to capture all the detail you need to get a final restoration that actually fits the first time correctly, that is money well spent. Because if you try to extend the use of a quadrant tray and you get back a 3-unit bridge that doesn't fit or the occlusion is off, and now you have to send that back to get it redone with another new impression, you've wasted a lot of your time, you've wasted your lab time, and you certainly wasted your patient's time. So even though I get they're uncomfortable for the patient and it costs us a little more money for the material, in the right place, we need to be doing these. So don't take shortcuts here. You know, look at the parameters I laid out on this screen. Think about what you're doing. Think about the things we've talked about. And when you need them, you have to take them, you know, no matter how uncomfortable it is for the patient. I always explain to them, you know, I appreciate this is uncomfortable, but you're spending thousands of dollars. You don't want to come back an extra trip. We're going to do this, do it right, so that we make you a great restoration and we don't make you have to come back because something doesn't fit. So custom trays, can't talk about impressions without talking about custom trays. Certainly, if you're a prosthodontist, you need to have a custom tray. I think it's like written into your licensure and your graduation from a prost program. Never take an impression without a custom tray. Certainly have their place. They do, and it's been shown in the research, provide a higher degree of detail and accuracy. But many of us have seen over the years, we don't have to go to custom trays to get really good impressions and final restorations. But they're out there. There's absolutely people who believe in them. There's no reason not to do them. It's an added expense. It can be an added step, added appointment. But they absolutely have their purpose in what we do in dentistry. For me, if I have a very unique arch form, lots of tori, a V-shaped arch, a high palate, things like that, we will go to the extra effort and get a custom tray made so that we can get a good final impression with a tray that fits that patient correctly. But of note, along the idea of custom trays, I think one of the things we will see in the near future as in-office printing becomes more and more popular, and it will, because the prices are dropping and many of manufacturers are coming out with printers, we will start printing custom trays in our office. I have no doubt it'll happen. I know it's happening in other offices right now. I'm not doing it, but certainly one of the things I'm looking at printers, and when I bring one into the office, one of the things I'm going to be looking for is, will I have the ability to be able to print a custom tray? So somewhere down the road, I know that I will be doing that because I appreciate the increased accuracy of a custom tray and what that provides. When I have the speed to do it with a printer in my office, I'm going to be more likely to go to that type of tray. So something to keep an eye on as you're watching technology as it develops and as the price of technology becomes more affordable is looking at in-office printing and coming up with your list. What am I going to do with this? But one of the things on that list would be fabricating custom trays. Okay, talking a little bit about impressions for implants, because implants will provide their own unique challenges when we're doing them. Now, with a single unit implant, oftentimes I could do that with a quadrant tray. Now, the lab, the technicians are probably always going to ask you for a full arch tray, but I can tell you from experience, I've done a lot of single units, done them in quadrant trays, and I've gotten very good final restorations back for my implant cases. But the purists in the lab industry really do want the full arches. I understand why. You need to look at each case. The use of quadrant trays follows the same rules that I discussed earlier. Most posterior tooth, you definitely want a full arch tray. But if you have a posterior stop, using a quadrant tray would usually be fine. The thing I want to point out with implants is the open tray versus closed tray. And especially in this case right here, and I want to credit the guys at Maverick Lab. This is a case they shared the photo with me, and it really demonstrates what I want to explain. Open tray versus closed tray. So when you put in your impression posts, if you were to do this case as a closed tray case, and you place those impression posts, and now you try to take the impression, when you try to pull this impression, the angle difference between these two implants is going to lead it to be highly likely you're going to rip the impression in here. And that will lead, without a doubt, to inaccuracies in your final impression. But with the angle of these implants, if you try to do open tray for both of them, you won't be able to get them down because these two are going to hit each other somewhere up here, right? So in a case like this, I would do this one as a closed tray impression post, and I would do this one as an open tray, so that when my impression tray is sitting here and it's set, I unscrew this one, it will come out passively, and then this one will come out, but it won't tear the impression material that was captured in here. Okay, does that make sense? So you need to look at your implants and the angulation of the placement when you're deciding, do I do closed tray or open tray? Because you may, in fact, have to do these with a combination of different types of impression posts. So pay close attention to that when you're looking at your case and you're deciding, how am I going to take the impression? What am I going to use? What parts am I going to order? But you get a case like this, you're going to need one of these to be a closed tray and one to be an open tray. when you're picking the impression posts. Otherwise, you're going to get distortion right in here. So need to take a really good look at that. And the challenge, going back one slide, when you have a case like this, where you have 4 or 5, 6 impression posts that you're trying to capture, is looking at the angles. Now, for me, when I'm doing these, I try to do open tray with every one of them so that I can unscrew them and I can passively remove them when I take the impression. But if these two were really close together and the angulation was presented the challenge I just showed you, I might have to use a different combination of impression posts. So want to make you guys aware of that, and just look at your cases. And because these things are expensive, when you order those impression posts, they're expensive. When you open them, you've bought them, you can't return them. So be sure you're looking and evaluating your case, ordering the parts that you need for that particular case. Okay, if we're talking about impressions, bite registration materials are just part of the deal. You need to capture a good bite registration. Anymore, most all of us are using a polyvinyl fast-setting bite registration material. This is just one of many on the market. The interesting thing about the product line that Voco has, they also have a scannable bite registration material, and as most of our labs are going to digitally scanning all of our cases, having a bite registration material that's optically optimized to scan more accurately is a really good idea to have in the office. So you need to talk to your laboratory technician and ask them, would it help you if my bite registration material is designed, specifically designed to be used to be scanned in the lab? Just a question you should be asking. It helps the final accuracy of your final restoration. The other thing about bite registration materials is they are designed to set really quickly, and you can use them for other things. And one of the techniques that we'll use is we'll use a combination of this bite registration material, a fast-setting light body wash, and a quadrant tray to be the pre-op impression for our temporary crown. The benefit of this is this combination of fast-setting wash and bite registration material, I can place it in this closed tray and capture my pre-op impression. It'll be set in 2 and 2.5 minutes, just about as fast as the alginate. But the benefit of this is when I get the pre-op impression using this series of materials, I can keep the pre-op impression and I can store it. And if the patient loses or breaks or temporary, I can go back to this impression that I took a week or 2 ago, and I can remake the temporary crown, and I can do it in a very quick and efficient manner. If I do my pre-op impression in an alginate material, the alginate will distort quickly and not be usable the following day. So if the patient breaks or loses or temporary, now I have to freehand a temporary crown in the middle of a busy day on an emergency patient, and freehanding a temporary crown takes me significantly longer than if I already have the pre-op impression on hand. So if you're not doing this already, one of the things you may want to do is start doing your pre-op impressions in a polyvinyl impression material and saving that. So in case of that emergency, you can make a temporary crown in a much faster manner. And the combination of bite registration material with the wash material will capture incredible detail in the pre-op impression, and it'll minimize the amount of time you're spent trimming the temporary crown. So something we've done for years, and we found out, when we need it, we really need it, because those emergencies always happen on the worst day for an emergency to happen, as you guys know. So it's just come in really handy. And the little bit of extra expense for using a little bit of material makes up all the difference in the time spent when you have to deal with an emergency patient. The other thing on the subject of temporaries to share with you that we do, and it's worked really well over the years, is using a polyvinyl putty impression material. And this is Voca's putty impression material called Viposil. And what we do is when we're doing an 8 or 10 unit veneer case, so we got 8 units here. So we do a wax up model that is our vision of the final restorations. Okay, so pre-op model goes to the lab, pre-op impressions go to the lab. The lab fabricates a wax up of our desired result. We take the wax up and we mix the putty impression material, and then we press fit it to the wax up. And this gives us great detail of the wax up captured in the putty impression. And then I just take a scalpel blade and I trim off some of the excess impression material, and I'll indicate midline, canine, canine. That helps me visually be able to seat the this impression back into place. So with this, once I'm done with the prep and I've got the impression and all that, I just load my temporary material in here. This becomes my pre-op impression. I seat that to place, and I'm able to transfer this wax up using this onto the patient. And now the wax up that we looked at on the model is now in the patient's mouth, and they're wearing this as their temporaries. But it's a really good way to make highly aesthetic veneer temporaries in a very fast manner. And it gives the patient a great pre-op view of what the final restorations will look like. So if you haven't tried that before, this is something we just, 15 years at least, been using this technique, and it works great. We're able to provide beautiful temporaries using that technique. And there are not a lot of companies that make putty impression material like this anymore. A lot of them come in these big bulk tubes. This does not allow you to do this technique. Okay, it's got to be coming out of these putty jars, mixed by hand. Takes a little bit of extra time, but the detail you're able to capture and the ease of use of that matrix for making the temporaries is well worth it. So last thing we need to look at is material selection and what combination of materials. If I'm doing 1 or 2 units in the same quadrant, I'm typically going with a heavy body and a light or extra light wash. Typically, I'm going to use the facet material, get in, out, get the impression out of there as quick as we can. You can use a putty wash combination. I don't do that, but there are those who like that technique. With full arch impressions, again, I've always been a heavy body with a light body or an extra light body wash material. Typically, if I'm doing a full arch impression, I'm probably doing multiple teeth. It's going to take me a little bit longer, so I go to the regular set as opposed to the fast set, just so I have enough time. I'm not rushed. The material's not setting up before I'm ready for it to. So that's my full arch combination. Again, there are others that like the putty wash combination. Not my favorite, but that's personal choice. And then the material itself, there's a lot of different impression materials on the market. There's a lot of really good impression materials on the market. You need to look for the type of impression materials that are going to work well for the techniques that you like. But things you need to look at in impression materials, obviously the precision of the impression material is very important. The working time is dependent on your techniques, as is setting time. I like having materials where I have the option of fast set versus regular set. Setting behavior, and we'll talk about this in a minute, one of the more unique properties of the VipoSil product by Voco is a snap set property. We'll show that in another slide or two. Contact angle and hydrophilicity. These have been shown to be very important. Aquasil, for many years, did a great job of explaining contact angle to where we dentists could understand what that means and why it's important. But it's a way to measure hydrophilicity and why a low contact angle is important. Again, we're going to show that in a second. Material needs to have good tear strength. Certainly you don't want to be tearing off impression material in a sulcus. And the elastic recovery is important because when you pull the impression out of the mouth, there is a little bit of stretch. But when it stretches, it can't distort, so it has to recover. Dimensional accuracy, obviously, is very important. And hydrophilicity after set, we're going to talk about in a minute, because that's an important thing that we don't really think about, that isn't talked about a lot by a lot of manufacturers. So with the VipoSil, which is, I'll use 3 different impression materials in the office, and this has been one of them for many, many years. One of the things I like about this product is the setting behavior. So you have your working time here, and this is in comparison to Aquasil, but Aquasil's one of the more popular, if not the most popular impression material on the market, so it's a good benchmark to measure against. So your working time is right here. How much time do you have to extrude the material, get it in the tray, get it around the tooth, and it maintains its flowability characteristics? Okay, so there's your working time. And now here comes your setting time. And one of excuse me, one of the unique things about VipoSil is when it meets a temperature change, going from room temperature to body temperature, that accelerates the set time and it becomes more stable. So whereas Aquasil and most others are going to follow this kind of gradual curve up to its final set, the VipoSil, because it's temperature sensitive, when it gets in the mouth and it raises to body temperature from room temperature, it immediately starts to set. And the final set happens faster. So you have a bit of control over the set time. And where this is important, between this period of time and this period of time, you know, this 40 to 60 seconds, the impression tray is sitting in the mouth. And if your assistant or you aren't holding it stable, or the patient moves, coughs, starts to gag, if something happens in there, the impression could distort in here. Whereas the VipoSil, you got about 10, 20 seconds in here where it's going to this final stabilized set. So it reduces the room for error as the material goes to its final set. So that speed of set and almost a command set, lack of a better word, is a big advantage of the product. And especially when you're doing a full arch impression, I think that's really important, because this is where the movement can happen. Patient gets uncomfortable, they start to gag a little bit. You know, they're bumping around your hand, your assistant's hand, while you're trying to hold it stable, and it may cause some distortion. So this advantage to me is a big advantage because it removes room for error. Okay, contact angle is certainly important. Aquasil for many years has shown low contact angle leads to better flow, leads to better capture of the margins. In areas where you may have some fluid, a lower contact angle allows the impression material to behave a little more hydrophilic and move better in a liquid environment. Again, not ideal. We talked about that at the very beginning. You don't want fluid in your sulcus, but if there is a little bit, a lower contact angle will help you get a better impression. So this is just the diagram of the VipoSil Lite, and you can see the very low contact angle that that material has. So it has hydrophilic-like properties to help capture the margins. But the other thing that's not talked about that is critically important is a hydrophilicity when you're pouring up your model. This is really important. So what really grabbed my attention when I was looking at the Vipasil material way back when was it stays a hydrophilic-like material when you go to pour the model. Because when you're pouring the model, that stone is in a slurry, and you need to flow it as you vibrate it into the impression. And the better it flows, the lower the contact angle, the better detail you're going to capture in your final impression. So this, to me, is a unique and important property that I haven't seen other companies talk about in their material. But when Voco put out their numbers, when they did their studies, a dramatic difference in this contact angle versus other popular impression materials. So this, to me, again, a very unique but very important property of this material. So with that, I've got a few minutes where we can go through some questions. They should be popping up on my screen here in a minute. Okay. Oh, hold it. There we go. I'm just reading a question here. Okay. I find a lot of the time when I use two-cord method, I get instant bleeding when I pull the cord. I do work at the... I see a lot of patients with very poor dental hygiene. Don't want to saturate the cord in hemostatic agents. Study shows that will interfere with final set suggestions. Okay. So what Alex is asking me here is he's trying to use a two-cord technique. Sounds like his patient base, the soft tissue health in general isn't that great, and he's working in a little bit of a compromised situation where he's placing the two cords, but two cords is a traumatic technique, and if the tissue isn't healthy when you pull that first cord, the top cord, the tissue probably will bleed on you. I get it. I've had situations where I've been in that same, I've had that same problem. My suggestion to you, Alex, would be don't do the two-cord technique. Do a one-cord technique and then use the hemostatic material, the Viscostat Clear, or the retraction paste. That way you're going to minimize the amount of trauma to the tissue and minimize the potential for that bleeding to start. The other option, whenever possible, is don't use cord at all and just use retraction paste all by itself, because that way you're not traumatizing this tissue that's already been irritated and it's not as healthy as we'd like it to be. But if you minimize the trauma to the tissue, what I found is a combination of I'll inject 2% lidocaine with 1 to 100,000 epinephrine right into the papilla. Use that as a hemostatic agent, and then use retraction paste to retract the tissue and expose the margin. And that combination has often worked well when I've found myself in the situation you're describing. So hope that one helps. And it looks like I am just about out of time. So to share with you guys in conclusion, think about the things we talked about. Soft tissue control is the most important part of what we do. If you control the tissue really well, there's a lot of good impression materials you can use that'll capture the detail you're looking for. So that's your number one priority. But there's a lot of other factors involved. If you do have good soft tissue control, use the right trays. Think about your clinical situation, especially with the implants, as we talked about. And then with your materials, use materials that fit your technique. And one technique isn't going to be the technique you're going to use for everything. Different combination of materials are going to work better in different situations. And learn about the physical properties of the materials you're using. And don't be afraid to try a different material. Okay, there's a lot of really good impression materials on the market, but there may be one that works better for you than the one you're currently using. So don't be afraid to try something new. If you're struggling and you think you're doing everything else right, it may be you just need to look at your materials, and another material with a different type of handling property may work best in your hands. So I'm at the finish line. Thank you guys for taking an hour out of your life. I hope you picked up one or two things that might help you be more successful with taking impressions in your office. Have a good evening, everyone.